I'm now going to perform a modified knots test. So the modified knots test is used to find microfilaria in pets that are heartworm positive. It can also be used to differentiate between microfilaria and other parasites. So what you want to do is you need 1 ml of anticoagulated blood, you need 9 ml of 2% formalin, and a 15 ml centrifuge tube, which I do not have. I have 2 6 ml white top tubes. So what I'm going to do is I'm going to put a 1/2 ml of the anticoagulated blood in each tube. And then I'm going to add 4.5 mils of the formalin to each tube. So I've just divided it in half since I do not have the 15 ml centrifuge tube. And then you want to gently invert the tubes 4 or 5 times to mix your sample. And then we're going to centrifuge the tubes for 5 minutes at 1500 RPM. So now that our samples are done spinning, we're going to remove them from the centrifuge. And you want to dump off the supernatant without disturbing the pellet. And then we're going to add 1 drop of the new methylene blue. And then we're going to take our pipette and mix the sample, the new methylene blue, with the pellet. And then you take 1 drop of the sample and place it on a microscope slide. Apply a cover slip. And then we're now going to look at this under the microscope. And we're looking for microfilaria and or other parasites. And you want to scan the slide completely. So that you don't miss any potential microfilaria or parasites. this patient appears to be negative for microfilaria or other parasites. Symptoms that a patient may have that would cause you to recommend fungal testing would be if the pet is rubbing, licking, itching a lot, if the skin is dry and flaky, or if it's greasy, if there's a bad odor from the pet, if the skin is pink or red, or you're seeing any crusts or lesions on the pet. Those would all be indications that the pet may need fungal testing. So this is Willie. We're going to do a fungal culture test on him. He has presented for red, irritated skin. He's been scratching and licking a lot. And he's got some lesions under his armpits and in his inguinal area. So we're going to test a sample from his inguinal area. Now what we want to do is pick an area that has either a newly formed crust or a lesion that is just getting bigger and bigger. So what we need to do is we have our culture plate. It's got his name on it, the client's ID, and the date we're taking the sample. We're going to use our sterile hemostat. And what we're going to do is take a few hairs and skin cells from around the outside edge of one of these crusts or lesions. Just like that. And boy. And then we're going to open our cap to our culture plate and place the hairs into the medium. You want to press them in firmly, but not so much that you disrupt the medium. We'll put our cap back on, and we're now going to store this in a closed drawer for the next 3 to 5 days, checking on it daily. To look for any kind of growth. You want to keep it at room temperature in a dark area and check it daily. Another method that can be used to obtain a fungal sample from a pet would be to use the toothbrush method. You would take a new toothbrush out of its package and gently rub it over the affected lesion. This collects hair as well as skin cells, and then you would place the toothbrush into the medium gently so that you press those cells and hairs into the medium without disrupting it. And then you would then store that plate in the same way as you would the hair pluck method. So it's been 5 days and Willie's fungal culture appears to have no growth. This is a dextrose agar, so this particular plate does not change color. But we're still going to prepare a tape mount just to make sure we don't see any spores, or and that way if we do, we can maybe identify the type of fungal spores or bacteria that may be on his skin. So we're going to take about a 2-inch piece of clear cellophane tape, and we're actually going to place it right onto the sample in our plate, and then the tape acts as its own cover slip, so we're going to place it right onto the microscope slide, and then we're going to take the slide and dip it in the dark blue stain. And dry it as best we can. Can even rinse the back of it with some distilled water just to rinse the extra blue off of it. Like that. Wiping the back of the slide dry. And now we're going to look at this under the microscope to check and see if we see any fungal spores. I do see lots of bacteria on his skin. Lots and lots of bacteria. I don't see any spores. And I do not see any yeast. But it appears as though Willie may have a bacterial skin infection instead of a fungal infection. So we're going to perform a necropsy on this cat. The purpose of doing a necropsy would be to determine the cause of death in the animal. Other reasons would be to bring peace of mind to the owners if they don't know why their pet passed away. It also brings a greater knowledge of disease processes and injuries within the animal to be able to do necropsies, so we can have a better understanding of what happened and how they passed away.
So starting the necropsy, first we look at the external exam of the animal. This is a female cat. We do not know at this time if it was spayed or not. We will discover that with internal exam. We have previously weighed this cat before placing on the table, and she was exactly 5 pounds 0 ounces. So I would say body condition score of this cat is about a 3 out of 9 with prominent bone, very little muscle mass, and fat deposit. Looking through her fur, I see flea dirt and some fleas. Okay, we will turn her over on the other side. No external wounds so far that I'm noticing. No masses that I'm palpating. No broken bones. She was not a declawed cat. This little bit of her tongue sticking out and a little bit of blood that I see from her nose could be post-mortem changes, but we will do further investigation when we do her internal exam. So we will go ahead and stabilize her in dorsal recumbency to allow us to do further internal exam. And again, no palpable masses or external wounds noted. I'm just going to go ahead and clip a little bit of fur while you stabilize that next leg. Just for a little bit of a cleaner working environment. Do not see anything that's obvious spay scar, but we will continue to investigate that as we go along. Now, if this was a necropsy that we were really concerned about, say, infectious disease, we would actually want to really do a full sterile prep, and that way we would be able to get samples that would be sent off for microbiology evaluation. In this exam, we're doing more of a gross necropsy. We will collect some samples for pathology, but not necessarily microbiology exam. So I like to use a 10 blade for my cat necropsies. I'll go ahead and put that on a scalpel holder. All right, we'll start with a midline incision. I usually start with the abdomen and then I'll move into the chest as well. And cats go all the way up to the xiphoid very easily. All right, so the first look at her, what I am seeing is a very full stomach. And I actually nicked the stomach a little bit when I was cutting in, and she does have food inside that stomach. We have her spleen here. Do not see any masses, no evidence of trauma. This would be her left kidney here. And these are all her small intestinal loops. Let's see if she is a spayed kitty. So this right here is her bladder, which is almost empty. And this is her colon coming down. Let's see. And no, she is not a spayed kitty.
Yeah, that's the ovary.
Good job, yeah. So this would be the left horn of her uterus. And then coming up here would be the right horn of her uterus.
Mm-hmm.
And there's her right ovary.
Right ovary. Mm-hmm.
Okay, and then what is this organ up here?
That would be her liver.
Okay.
Looks nice and smooth.
And I don't see any evidence of hemorrhage, masses. Okay, and then we will investigate for her pancreas and her right kidney. So here is her right kidney.
Mm-hmm.
Here is a sliver of her pancreas. All right. We can go ahead and move into her chest cavity. Now, larger dogs, a lot of times you'll need, say, like bone saws to get through those ribs. Cats, it's not quite as difficult. I'll go ahead and get some. Okay. So you can see that her diaphragm is intact, so that would be something to clarify too. If it was a hit by a car, there's, say, a diaphragmatic hernia possibly going on, but her diaphragm's intact. Continue to. Okay. All right. Do you want to show me where the heart is?
That would be her heart right there in the middle.
Yeah.
Mm-hmm.
So one thing right there, like, is that the pericardial sac is intact. There's no hemorrhage around it. Which in dogs, that's something that's really important to look at, whether or not they say had like pericardial sac hemorrhage. So that would suggest like a mandrasarcoma mass, something like that. Okay.
Appears to be small and normal size.
Mm-hmm. And these right here.
And long lobes.
Yep. Don't see anything suggestive of any cancer or anything like that, but we will take some samples. And in this particular exam, we will not be doing a skull exam, but what would be a good reason to say send the skull off?
Had it been a rabies suspect.
Mm-hmm. And sometimes in neurological cases, brain tumor. Okay, and you can even extend all the way up into the neck. Look at the trachea, the esophagus. Again, cats, a little easier to get into. They're a little bit smaller, the tissues are not as thick. Trachea seems to palpates to be intact. Actually, you can feel the ridges.
Feel the rings, the tracheal rings. Yes, yes.
Yeah. All right. So let's go ahead and get some samples.
Okay, I've got my sample jars prepared with the kitty's name, the date of birth of the kitty. It says feline on it, and I've also got my tape wrapped around this to secure so I can write on it with permanent marker what sample is going in this jar. You want to wrap the tape all the way around so that it can't moisture and water can't loosen the tape or perfuse it. Just want to make sure your jar is labeled permanently so that there's no question when it gets to the lab. And this is 10% formalin we're going to be placing our samples into.
So say, for example, we were wondering if this old kitty died of cancer. We would want to take multiple samples because a common cancer in older cats is lymphoma. If it was, say obviously if you saw a mass, you would want to completely remove that entire mass if that was possible to send that off. In this particular kitty, let's go ahead and we'll do a liver sample. And you always want to hold the tissue that you're trying to get a biopsy of with forceps so you don't actually accidentally cut your finger while using the scalpel blade to grab your sample. So I'll take a section of this liver here.
And you ideally want 10 parts to 1 piece of the tissue sample of formalin. And seal the jar tightly. And we're going to label that liver.
Okay, I'm going to go ahead and get a sample of this lung. This would be left lung tissue.
Again, I've got my cat's name on the jar with all of the information, and then I'm going to label the jar lung so there's no question at the lab.
Thank you. Okay, now I'll go ahead